This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Enter the
Supposed
second.
to help first or
Medical Dilemma.
Hi everyone, you're watching Medical Dilemma right here on GNN. I'm Atty. Sara Suguitan, your host for today. Today we're going to tackle addiction medicine, and with us is Dr. Alfonso Villaroman, founding fellow of the Philippine College of Addiction Medicine. Hi, Dr. Villaroman.
Hello,
Welcome
guys.
to the show.
Thank you, it's an honor.
Dr. Villaroman, how did you get into this practice, addiction medicine? It sounds, I can't say it's rare or anything, but it sounds so specialized. Did you?
Well, it is a specialized field, but it's also composed of other specialties. The doctors can be psychologists, can be psychiatrists, they can be family med practitioners, surgeons, pediatric practitioners.
Really?
But they concentrate more on the realm of substance dependence or other forms of addiction.
Of addiction. So when you say addiction, doctor, so is this limited to substance addiction? Or
No, it's not. It's also limited to activities like gambling.
Oh, there you go. Yes.
Yeah.
That is also addictive.
Internet addiction is also one of them.
Yes.
Selfie
that's
addiction,
true.
like what
Yes.
you mentioned earlier.
Yes, that's
among
a
others.
new form of addiction. Pero medically speaking, doc, how do we define addiction? What
Well,
if
addiction-
talagang mahilig ka lang mag-Facebook or mag-selfie?
Addiction basically is described as behavior actions wherein a person exposes himself to either substances or activities that become detrimental to his self. It could be that nawawalan siya ng trabaho, naapektuhan ng pag-aaral, yung health niya, naapektuhan. So even despite that they continue to use, there are certain criteria that identify addictions. Especially we have the DSM and the ICD-10, which are psychiatric diagnostic criteria.
Right.
So one will say that if you constantly use drugs or substances, despite medical, legal, social detriment, you still it is tantamount to addiction. Isipin mo, like for example, you wake up in the morning, the first thing you do, normal people will brush their teeth, take a
Yes.
bath, pray or do other things similar to that. So ang mga persons na addicted to substances, the first thing they'll think of is where I
they
can
wake
get
up.
money to buy drugs or when I can use drugs.
Iba na yung framework nila. And as you said,
Yeah.
may detriment. So
Detrimental,
personally and
yeah.
detrimental to the person's social life, etc. And it affects their ability to function.
Exactly.
So kasi sabi niyo nga, ako I'm sometimes worried because I feel like I'm so attached to my mobile phone that when I wake up, sabi mo, the first thing you check your email before you even get out of bed, brush your teeth, and have breakfast, etc.
Well, what would probably set you different from other people who are dependent on it is that you cannot work because you're too preoccupied with playing your Farmville or something like
Or your
that,
games, yes.
Or you're always attached to the phone, that you cannot entertain other people, you cannot do your job as a lawyer, etc. Or we cannot even talk here in front of television. Kasi nandun kasi isang sulok, nagtitinker ka sa cellphone mo, sa gadget mo.
Yeah, and it would be the same if it's a substance addiction, for example, or
Well,
alcohol.
yeah, it's similar. Because, in the brain, we have what we call the pleasure areas. There are 3 areas, actually, although they're a bit technical to describe, it's the VTA, or ventral tegmental nucleus of the
brain.
nucleus, and the nucleus accumbens, and the prefrontal cortex, with all the centers for pleasure. And one in particular is yung sa shabu, addiction to stimulants like shabu. This, when you are exposed to the substance, nagkakaroon ka ng flooding of dopamine. Dopamine is a feel-good neurotransmitter which is normally secreted in the brain.
Right.
But when you take that drug, it's flooded. You get flooded by this. So as you get flooded, nag-a-adapt din yung brain mo Di ba? Parang,
Nag-a-adjust.
kunyari, lagi mong ginaganyan ang kamay mo,
yes.
magkakakalyo yan.
Oo,
Similar to that,
perfection.
nagkakaroon ng magdi-decrease ng production ng dopamine, tapos yung receptors that are responsible for getting the dopamine will be depleted as well. So, if you are not exposed to the substance, yung level of chemicals in the brain is not stable, is not balanced. So, either you feel subnormal, and you have to take the drug to feel normal. With gambling addiction and other
Activities,
non-substance dependencies or addictions, the pathway is similar. There is also the pleasure. And the addiction is because of the either the risk of taking the risk in gambling or the pleasure in playing the game that is constantly bombarding you. So some people cannot really resist. They become dependent on it.
On that feeling of,
Yeah.
as you said, that overflow of dopamine in the brain. So you keep seeking that pleasure over and over again.
Yeah.
So you become dependent
Yeah.
on that,
Yeah.
to the point that you can't function as a normal
Yeah.
human being, as you say. Pero, Doctor, I mean, you're in the field of addiction medicine. So
Yeah.
in this show, we're going to talk about, aside from what are the medical dilemmas, for example, that you think a practitioner will face, or a family and the patient's family will also face. And then also, meron ba yung mga, like, of course, legally, I mean, what laws are applicable, especially in substance abuse. So we're going to tackle all of that. And of course, treatment. So you're one of the founding fellows of the Philippine College of
There are more than 30
Addiction
actually.
Medicine. Yeah, so I mean, we'd also like to tackle that. Like, how long has the Philippine College of Addiction Medicine been, I mean, on what years na ba? Ilang years na ba yan? And also, I mean, how is the practice nationwide of those who specialize in addiction medicine? Are people aware of this? Do people need this? Is there a demand?
Yeah. So where do we start first?
Siguro with the Philippine College of Addiction Medicine,
Okay,
which
we'll
you
talk about the
founded.
Philippine College of Addiction Medicine. We conceptualized this because there was a need to have an evidence-based and professional management with addiction. Nung araw kasi, well, back in the 70s,
Yes.
like, patients would be put in an institution, which is usually run by military or police. At that time, it seemed right for them, but the treatment was military. They put them in boot camp. There was
Almost like
more.
prison.
There was really little knowledge in what happens when a person becomes addicted. And nung araw kasi they did not believe that addiction was an illness. They would say it's a malady of society. So
That you have to stamp
the
out
outlook
of the
was more of
person.
punishing the drug user for being a drug user. So, nag-iba ng pananaw. Because as time went on, research was already begun and continuing to be done on addictions, and we realized it's more of an illness.
It's more
It's
of
a
an
brain
illness.
disease, yeah.
Okay, doctor, let's hold that thought. And when we return right here on Medical Dilemma, Dr. Atty. Sanchez and Father Jerry Manlangit will join us in the panel. Stay tuned.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people.